Today on Medical Montana, I'll introduce you to Dr. Fife here at Town Center Chiropractic. Dr. Fife, it's nice to meet you today.
It's great to be here, Tim.
I understand that you have a very unique expertise called ART. Could you tell me about it?
Certainly, Tim. ART stands for the Active Release Technique, which is a specialized technique used to work on soft tissue. A lot of times if you have those spots in your muscles that are really tight, and those muscles just don't want to move, what the technique does is loosens them up. So they start to stretch, and pretty soon they start sliding back and forth like they're supposed to. For example, people have pain between the shoulders just from sitting at the computer, leaning forward. The afternoons it gets real tight, sometimes leads to headaches. A lot of that is because of cumulative trauma injuries. And that's a little bit at a time. The body just can't heal it. So it builds up over time, and then it gets a little bit worse and a little bit worse. And pretty soon, it needs some professional attention.
So these are the sorts of things that didn't necessarily happen from a real traumatic injury, but maybe just either a sedentary lifestyle or being in one position for long periods of time. Is that right?
Exactly. Although it can happen from trauma, I think it's more common that we see it for all those little things that build up.
Okay, now you call it a soft tissue problem. So how would you treat that?
Well, soft tissue is basically it's the muscles and tendons, and it's through motion. It's the active release technique. The patient moves through the motion the muscle goes through, and we handle that muscle in specific ways that really help to stretch it out and work out those damaged areas. And sometimes you can think of those as those tight little knots that you get in your muscles. Some are tiny, some are very large, and it's a way of getting rid of those.
And I would imagine that you've seen a lot of these, so you're pretty proficient at finding them quickly.
Oh yes, there's not too many people that come in that don't have something that looks like that can be addressed.
And I can be helped relatively quickly?
People tend to get better a little bit faster and stay better a little bit longer.
So I'll notice something in a few visits probably.
If you don't notice it in a few visits, it's not the thing for you.
All right. Thank you, Dr. Fife.
Thank you.